Together we found a couple small things that were okay with it and a lot of bad things, and that's what they used to blow it apart. But one of the things I said to Senator Dole is you need to propose an alternative. And he did, and that was the institution of health savings accounts. The leftists in the Senate took it apart and only let individuals or businesses with 50 or fewer employees have the tax break for health savings account through that legislation. Not the big companies. But I convinced the senator that he needed to have a measuring device to see if these things actually worked. They instituted them in 2000, they started measuring in 2004. They found that the number of people utilizing them exponentially went up every year. Next slide. 31% of the people that were covered by the health savings accounts were previously uninsured, that were now insured. 33% of small businesses with HSAs previously did not offer insurance because they could not afford any kind of insurance product, and now they could. The bottom line is health savings accounts provide health care freedom, operative word freedom, for every person, family, and business. Now, Bill Clinton said, and when Hillary Care got blown apart, the big parties, I said, don't, they're not going to stop. This is just a speed bump for them. They're going to try this again another way. And I quoted for them what Bill Clinton said right after he lost. If what I tried before won't work, maybe we can do it another way. That's what we've tried to do, a step at a time, until we eventually finish this. Next slide. This is what Hillary proposed. Now look. This created 76 new federal agencies, expanded the role of 20 federal agencies, introduced 74 new federal taxes to pay for it. If you look, patients are at the bottom, the gurus are at the top. Any system where the patients are at the bottom are bogus. In addition, second box right underneath Hillary's office, the office of the president, the National Healthcare Board. That National Healthcare Board was essentially role modeled after the British system, a rationing board. Now, as bad as that was, what we have gotten passed into legislation in March of 2010 is worse.
Exactly.
And let's go to it.
Oof.
As Nancy Reagan would say, just say no. The bottom line is it's a domestic Vietnam right now in healthcare, and I don't use that term loosely. I say that because one of the lessons learned out of the Vietnam experience is that the policymakers and the decision makers don't listen to the grunts in the front line, you're going to lose the war. And what grunts in healthcare are saying, the patients, the nurses, the therapists, and the doctors, what we're all saying is stop empowering yourselves and the HMOs and the insurance companies and empower people. Put the finances back in the hands of every person, family, and business. Instead, what we got was Obamacare. Now let's dissect it. I got in a lot of trouble when I did this on Glenn Beck's show. He had me on, and we talked for about an hour the day before the show about what was going to be said. And at the end of the conversation, he said, Dave, you're a good guy. He goes, you realize by being on my show that you will be threatened by your life. And he goes, when you say the things you tell me you're going to say, they're going to come after you. Are you prepared for that? And the answer I gave to him is, I've been doing this for 20 years. I've had everybody coming after me. My life's been threatened. My wife's life has been threatened based on things that I've done and said, and research we've done. My children's lives have been threatened to the point where they had to get protection going to school and coming home from school. The bottom line is, it's that critical, because if we don't talk about what this is about, every person here, every person you know is a victim. The bottom line is, and nobody